Welcome to the Fix Your Sciatica podcast, where we meet with experts and clients and discuss how to manage your sciatica and low back pain without the use of medications or surgery. I'm your host, Dr. Ashley Mack, and I'm a physical therapist as well as the founder of ifixyoursciatica.com, a go-to resource for pain management. Every now and then, I like to share with you a couple of my case studies of the clients that I've worked with in the past to share with you my thought process and also how we actually manage to help these folks. And so today, we actually have a woman in her 50s who is having sciatica pain, which is actually disguised as knee pain. And so how did this work? A few years ago, this woman reached out to me and said, Ashley, I've tried physical therapy in the past and I've been having a lot of knee pain, and I've already had a knee replacement on the right knee, but my left is killing me. But this pain is not the same as the arthritic pain that I had in the right knee that was replaced. Could you help me? Because again, I don't want surgery and I want to have it as minimal procedures done as possible. And in my position, I said, sure, let's take a look. Now, I had the opportunity to discuss with this client, and we were talking about how when you're recovering from a surgery, there are going to be what we call surgical protocols, which gives us guidelines in regards to what needs to be done to help recover from the procedure itself. With knee replacements, you're looking at a stepwise fashion to increase quad strength, hamstring strength, and glute strength, while also the knee surgery itself will be healing. And that recovery lasts between 6 to 12 weeks, depending on how that person is and depending on the surgical procedure. So in this case, this person didn't want to go through another knee surgery. So I said, let's take a look. Let's see what other options that are out there. Now, I know that this podcast is specifically about sciatica pain, but what's really interesting is the fact that when it comes to the irritation of the sciatic nerve actually supplies innervation or sensation and motor to the posterior aspect of the leg, which is the hamstrings, but also the lower leg, the area below your knee. So it's going to be your shin, your foot, and also your calf. And so let's talk about this person's presentation. They've been experiencing knee pain due to a chronic illness, and they developed a lot of quote-unquote arthritis. And they've gone through physical therapy in the past, and they actually had their right knee replaced. And they wanted to look at this left knee and see what was going on. And so the way that this pain was presenting was the following. And I want you to imagine this in your head. If you're looking at the human body, anything closer to the midline, aka anything closer to the line made by your belly button, is what we call the medial side, aka the inner side. And so for this person's left knee, she was experiencing pain on the inner aspect of her left knee, and it was tender to the touch. And it wasn't just tender to deep pressure. Even me gently brushing my hand over the inner aspect of her knee resulted in hypersensitivity and what is actually really painful. And then from there, she also described that on occasion, the pain would actually spread up to her hamstring and down her calf. And the moment she described that to me, I thought, well, this could be a couple different things. I'm not 100% certain that this was actually caused by the arthritis that is happening within the knee joint, because when you have arthritis within the knee joint itself, you're going to feel a lot of pain within your knee. You could also experience pain with bearing weight, aka stepping on that knee. And as a result, for this patient, she was actually experiencing more so point tenderness, and it was something that actually radiated both to her hamstring and her calf muscle, which then got me thinking, okay, well, let's go about and talk about the knee itself. Could it be that the knee joint was so swollen that it was actually pressing on the sciatic nerve, which actually crosses the knee joint? Possibly. We are going to take a quick break to tell you about our awesome new program called the Sciatica Protocol. If you don't have the time to see a professional but are tired of trying to figure out this recovery on your own, then the Sciatica Protocol is for you.
Harness the power of a knowledgeable physical therapist through your phone. It takes no more than 7 minutes per day, and it is designed to help you recover as quickly as possible. It is simple to start, and all you need to do is log into ifixyoursciatica.com/the-sciatica-protocol and fill out the 9-question quiz to begin. The link for the program is in today's show notes.
And so I said, let's talk about reducing a little bit more of that swelling that happens in the back of the knee. So there's many different ways that you can actually use, many techniques that you can use to reduce inflammation in any sort of what we call peripheral joints, any joints outside the body. Number one, we can elevate that body part. Number two, we can gently massage that body part, light enough to displace the skin, but not hard enough for you to wince and create a lot of pain. And if you do a gentle massage, circular motions in the direction of your heart, you should be able to reduce that pain. But another really interesting thing that she brought up was the fact that she just started using a new desk, or she was either starting to use a new desk, or she was actually sitting down a little bit more often because she was getting even busier in work. And then she said, Ashley, you know what, my back is killing me. And what was interesting was the fact that whatever body part you're addressing, it is important for clinicians, both doctors, physical therapists, chiropractors, it's important for us to be able to look at what is happening in the middle of the body that could be leading to this issue. And so when this person said, my back has been killing me, I said, oh, well, did your back pain also come about at the same time that the sensitivity in your knee has occurred? And she said, yes, a resounding yes. And I was still scratching my head. I was still suspecting, okay, maybe this could be a result of the knee issue itself. Let's go ahead and address this. So we started off taking a look at the range of motion in the knee. If you didn't know, there's two major range motions of the knee. You have bending the knee, and you have bending the knee and straightening out the knee. You also have a little bit of rotation. You also have a little bit of side to side as well. But the majority of the time, you want to get that knee straight as possible. And you also want to get that knee as bent as possible. From there, I said, you know what? Let's go ahead and move up the chain. Let's take a look at the back. And so I go through the same back assessment that I would go through with the people that I work with who have sciatic and low back pain. First thing is we want to take a look at range of motion and see how it is. So a very simple forward bend, letting you try to touch your toes, rounding as much as you can tolerate at the back. That actually produced and increased the back pain, but also increased the pain that was happening in the knee. Interestingly enough, some people might think, well, if you're leaning forward, you're putting a lot more tension on the knee. You could, but because there's a little bit more back pain and an increase in leg pain, they might be related to each other. So then we do a backwards bend. A backwards bend, hands on your butt, you lean back. Pain actually started to get a little bit better. And then we actually leaned away from the side of pain. And then when we leaned away from the side of pain, what was really interesting was that the pain in the back and in the leg completely went away. And so why was this the case? If you lean away from the side of pain and you're unloading that knee, okay, possibly we're unloading that knee, we're probably having a little bit of relief. But what was interesting, again, it was the spinal motion. And so what ended up happening was I said, okay, let's run with this. We're going to run with this back motion. And so we ended the session there where I had her focus on a standing back bend. You put your hands on your butt, lean back, because that felt like a good stretch and it made the pain go down. But then also throughout the day to be able to put the hand on the hip and lean away from the side of pain to open up that side of the spine, which we knew completely got rid of that knee pain. And how do we know that this was working? It was important for us to be able to see, let's try this stretch and see how it feels. And if it made you feel better, we're going to do a lot more out of it. And so this may seem like a very simplistic way to approach treatment, but when you are dealing with pain, it is important for you to focus on doing the activities that reduce the intensity, the size, and the type of pain that you're experiencing, and focus on those activities, and then avoid or minimize those opportunities where you're doing activities that actually increase your pain. I have been reiterating this over and over again, but this is a real time scenario where you can see if you move and it feels better, let's run with that. And that would be the program. And interestingly enough, we were actually able to get rid of this person's pain in approximately 3 visits because we were able to really nail down that the back was an issue. We also looked at workstation setup, because if we knew that sitting for a long period of time was actually causing a lot of pain, the reality is that we're going to have to sit down. And so we had to look at how can we modify sitting so that my patient could tolerate more sitting without putting her body at risk of getting injured. And so there you have it, a really interesting story where someone came into working with me who had a lot of knee pain, wasn't like the arthritic knee, and wanted a solution that was outside of the surgical standpoint. So I hope this gives you a little bit of hope that you can in fact recover, because as long as you follow those three main principles, number one, focus on the things that make you feel better. Number two, avoid the things that make you feel worse. And then number three, come up with a game plan to return back to doing the activities that you love. You are going to be way better and recover a lot faster than just trying to do everything on a shotgun approach. So I hope this was helpful. Thank you so much for tuning in. We hope you got some help from today's podcast. And for more info, check us out at ifixyoursciatica.com. Have a fantastic and pain-free day. No patient-therapist relationship is formed by listening to this podcast. We are not providing medical advice, and all information should be confirmed by a medical provider.